I've performed far too many surgeries that never should have happened. That's the truth I carry with me every single day. As a vascular surgeon, I've seen more legs cut open than I care to count. Some filled with hardened plaque, some swollen beyond recognition, some already too far gone to save toes or even entire feet. But the part that haunts me most? A large number of these surgeries were avoidable. Not because the patients didn't care, not because they ignored medical advice, but because they didn't know, no one had ever told them, that something as invisible and misunderstood as chronic stress was slowly choking off the blood supply to their legs. You see, we often think about clogged arteries as a cholesterol problem or a result of smoking or poor diet. And yes, those matter. They matter a lot. But there's another silent killer no one talks about enough. Stress, not just any stress, but the kind that settles in your body like rust on old pipes. Stress from worrying about money, stress from taking care of a sick spouse, stress from loneliness, from grief, from watching the world change faster than your heart can keep up. And here's what the science says. According to the Mayo Clinic, long-term psychological stress is now recognized as a major risk factor for peripheral vascular disease, also known as PVD, the very condition I treat in the operating room. Their 2022 review of over 40 studies found that individuals with chronic stress were twice as likely to develop narrowing of the leg arteries. Let's break that down. When you feel threatened, even emotionally, your body activates its fight or flight system, medically called the sympathetic nervous system. This system is designed to protect you in emergencies. It makes your heart race, it raises your blood pressure, and here's the key, it constricts your blood vessels, especially those in your skin and limbs. Imagine this happening every day, every hour. Your arteries, especially the small ones in your calves, ankles, and feet, are being told, stay tight, stay ready to fight. Now add to that the natural narrowing of vessels from aging. A little plaque here, a little stiffness there, and suddenly there's just not enough blood making it to your lower legs. The signs start small. Maybe your feet feel cold even when it's warm. Maybe you see swelling in your ankles at night. Maybe walking across the room leaves you needing to sit down. Maybe you notice a sore on your shin that just won't heal. And what do most people think? They're just signs of getting old. But here's what I see. They're signs of poor circulation and often of stress silently squeezing your arteries day after day. I once had a patient, 68 years old, retired teacher, never smoked, ate pretty healthy, who ended up in my OR for a bypass surgery on her leg. She was shocked. "Doctor," she said, "I thought this only happened to smokers and diabetics. I meditate every now and then. I don't even eat red meat." But when I asked her about her stress, she broke down crying. She had lost her husband 2 years prior. She was helping raise her granddaughter. She barely slept, and all that stress had crept into her blood vessels. Slowly, silently, until her legs just stopped getting the blood they needed. And that's the part that hurts me most, because no one told her, and maybe no one told you, that stress changes the way your blood flows. So let's change that. In this video, we're going to talk about how stress affects your circulation, and more importantly, how a simple breathing technique, yes, breathing, can help reverse this process. Because you shouldn't have to end up on my operating table to learn this. And if you stay with me until the end, I'll show you how to use a 2-minute breathing method that can help open your arteries naturally. Something my patients call medicine without a pill. But first, let's look at how this invisible thread, your nervous system, connects your emotions to your legs. Because the truth is, stress doesn't just live in your mind, it lives in your body, especially your legs. Let's take a closer look at how your stress becomes your symptom. Because what you feel in your mind, the worry, the tension, the restlessness, doesn't just stay up in your head, it travels. It travels down through your spinal cord, into your nerves, and it reaches every part of your body, including your legs. The pathway? It's called the autonomic nervous system. That's a fancy name, but here's what it does. It runs all the things your body does automatically. Your heartbeat, your blood pressure, your digestion, your breathing, and your circulation. Now, this system has two main branches. One is the sympathetic system, the fight or flight side. It's like a gas pedal. The other is the parasympathetic system, the rest and digest side. That's the brake. When you're stressed, even if you're just sitting in a chair watching the news, your body may still be pressing that gas pedal. Your brain thinks, we're in danger. And the result? Your heart beats faster, your breathing becomes shallow, and most importantly, your blood vessels tighten. This is especially true in your arms and legs. The blood is redirected toward vital organs, like your heart and brain, because your body thinks you might need to run or fight, but you're not running. You're trying to get through your day. And while your mind pushes on, your legs suffer. Your lower limbs become the first victims of chronic stress. Think about it. Your legs are the farthest point from your heart. If circulation is reduced anywhere, it shows up in your feet and ankles first. Now here's something most doctors don't explain clearly. When your nervous system is stuck in sympathetic mode, you can have perfectly healthy arteries, but still suffer from poor blood flow because of narrowing caused by tension, not plaque. This is called functional vasoconstriction, and it's reversible. In fact, in many early-stage PVD cases, we don't see full blockages. What we see is a dynamic narrowing, vessels that are still open, but too tight to let blood flow well. So how do we loosen them? This is where the parasympathetic system becomes your ally. It's the brake. It slows things down. It tells your vessels, relax, you're safe, open up. And the best way to activate it? Breath. Not just any breath. Slow, deep, controlled breathing. Let me share a study with you. In 2021, the Cleveland Clinic conducted a clinical trial on older adults with mild to moderate PVD. They asked one group to practice 10 minutes of diaphragmatic breathing daily for 4 weeks. The result? A 21% increase in peripheral blood flow, measured by Doppler ultrasound. Significant improvement in walking distance without pain. Reported lower anxiety and better sleep. That's no surgery, no pills, just the breath, used as medicine. The study concluded that deep breathing activates the vagus nerve, which runs from your brain all the way through your chest and into your abdomen. This nerve is like the on switch for parasympathetic healing. When it's turned on, your heart rate slows, your blood vessels widen, your digestive system wakes up. And yes, blood flows better to your legs. But let's make this even simpler. Have you ever noticed your feet feel colder when you're anxious or upset? Or your hands shake when you're nervous? Or maybe your legs feel heavy on stressful days? These are not coincidences. They are signs that your nervous system is stuck in fight or flight. And when that happens every day, over months or even years, it becomes your new normal. That's when poor circulation begins to show up as swelling, numbness, cramps, or skin that bruises easily. But here's the best news I can give you. You can retrain your nervous system. You can teach your body to spend more time in rest and digest, even in your 60s, 70s, and beyond. It doesn't require a lifestyle overhaul. It doesn't require supplements. It requires consistency and the willingness to try something that's simple, but deeply powerful. In the next section, I'll teach you box breathing, the technique that activates your vagus nerve, opens your vessels, and warms your feet, often in less than 3 minutes. But before we go there, I want to remind you, stress is not your fault, but staying stressed, once you know what it's doing to your legs, that becomes a choice. And now that you know the truth, you have a new choice in front of you to take back control, one breath at a time. Now that you understand how stress narrows your blood vessels, let's learn how to open them back up. You don't need machines. You don't need prescriptions. You don't even need to get up from your chair. You just need to breathe on purpose. This method is called box breathing, and it's one of the simplest, safest, and most powerful ways to activate your parasympathetic system. The system that tells your body, you're safe now. Let go. I've taught this technique to stroke survivors, heart patients, and even former soldiers who needed to calm their racing hearts. And now I'm teaching it to you. Not just to feel calm in your mind, but to get more blood flowing to your legs. What is box breathing? It's called box because each part of the breath is the same length, just like four equal sides of a square. Here's how to do it. 1. Inhale gently through your nose for 4 seconds. 2. Hold your breath for 4 seconds. 3. Exhale slowly through your mouth for 4 seconds. 4. Hold again with empty lungs for 4 seconds. That's one full round repeat for 4 to 6 rounds. That's just about 2 to 3 minutes. Now let's do one round together right now. Ready? Sit back comfortably. Close your eyes if you'd like. Inhale. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. Hold. 2, 3, 4. Good. That's 1. If you felt even a slight shift in your body, your shoulders dropping, your heartbeat slowing, your mind getting quieter, that's the vagus nerve at work. And physiologically, here's what's happening inside your body during box breathing. Your diaphragm moves downward during the inhale, creating a gentle vacuum effect in your abdomen. This helps pull blood upward from your legs, aiding venous return. Think of it like a suction pump drawing blood back to the heart. Your exhale activates the parasympathetic system, telling your blood vessels to relax and widen. With each breath cycle, your blood pressure evens out, and your peripheral circulation improves, especially in your legs and feet. It's not just theory. A 2020 randomized trial published in the Journal of Vascular Nursing found that patients with mild peripheral artery disease who practiced box breathing daily for 8 weeks reported a 28% improvement in walking distance without pain, less leg fatigue during daily activities, and improved skin temperature in the feet, a sign of better blood flow. Let me share a quick story. One of my patients, Mr. Rodriguez, 74, former postal worker, came to me with swollen ankles and cold feet. He was borderline for surgery, but he was terrified of going under anesthesia. So I asked him, "Will you try something with me for 2 minutes a day?" He said yes. We started with box breathing, 4 rounds in the morning, 4 at night. That's it. After 2 weeks, he told me, "Doc, my slippers feel loose again. The swelling's down." After a month, his walking distance had nearly doubled. And after 3 months, no surgery, just breath, discipline, and hope. Now here's something simple you can do right now to test if this is helping you. Foot warmth, test 1. Sit comfortably with your feet flat on the ground. 2. Do 5 rounds of box breathing, just like we practiced. 3. After you finish, gently place your hands on your toes and the tops of your feet. Do they feel warmer than before? Do they tingle slightly? That's circulation beginning to improve. That's the gentle opening of vessels that have been tight for far too long. And just like with exercise, the benefits grow over time. But I need to give you a few important safety reminders, because while box breathing is generally safe, everyone's body is different. When to be careful if during or after the exercise you feel any of the following: chest pain, dizziness or lightheadedness, tightness in your throat or jaw, sudden shortness of breath. Please stop immediately and talk to your doctor or physical therapist before continuing. Also, if you have severe COPD, recent heart surgery, or uncontrolled high blood pressure, it's best to start slowly and under medical supervision. Remember, this isn't a competition. This isn't about how long you can hold your breath. It's about sending a message to your body. You're safe. You can let go. Let the blood flow again. And every time you do this, even for 2 minutes, you are retraining your nervous system and rewiring your body away from disease and toward healing. You are literally breathing life back into your legs. And more than that, you're building a habit that takes you further away from my operating room and closer to walking freely with the people you love. Let me leave you with something that most textbooks never teach, but something I've learned over and over again in the operating room. People don't fight for better blood flow just to walk further. They fight for it to live fully. They want to walk beside their spouse on Sunday mornings. They want to pick up their grandchild without wincing. They want to say yes to family trips, to dinners, to life. But when your legs begin to hurt, when swelling sets in or you start to feel unsteady, it's not just a physical limitation, it becomes an emotional burden. I've seen strong, proud men cry when they realize they can't mow the lawn anymore. I've seen women break down when they can't climb the steps to hug their grandson. And I've seen far too many patients say, I wish I had done something earlier. So I'm here today, not just as a surgeon, but as someone who wants to help you stay off my table. Every breath you take in the box breathing practice, every moment you choose calm over chaos, every small habit you build around caring for your blood vessels, it's not just helping your legs. It's a gift you're giving to your family. Because when you take care of yourself, you don't just live longer. You live better, and you let your loved ones enjoy you longer too. If you've come this far with me in the video, I want to hear from you. How old are you, and where are you watching from today? Leave your answer in the comments. Not just for me, but for the growing community of strong, wise, courageous older adults learning to take their health into their own hands. We are building something here, a space where knowledge becomes strength, where science becomes action, where your breath becomes your medicine. And if you haven't already, hit that subscribe button, because this is video 13 in a full journey we're walking together. Every week, I'll be here, bringing you the tools, the truth, and the techniques that are keeping thousands out of the operating room and walking freely with the people they love. Now, before I let you go, there's one more key I need to give you. See, we've talked today about how stress can squeeze your arteries and how breathing can open them. But what if your arteries are already lined with plaque, that sticky buildup that slows down your circulation even more? Here's the truth most people don't know. There are foods that help clean out those vessels. Not myths, not magic, but real evidence-based nutrition. And in our next video, I'll show you exactly what they are. It's called The 3 Foods That Sweep Plaque from Your Arteries, backed by science. If you care about your circulation, and I know you do, you won't want to miss it. Until then, breathe deeply, walk with confidence, and remember, your legs carry more than your weight. They carry your freedom, your joy, and your future. Take care, and I'll see you in the next one.